All right, I'm Dr. Aaron Baessler. I'm a shoulder and elbow surgeon at Central Indiana Orthopedics. I'm going to be talking a little bit about common elbows and common injuries in sport to the elbow specifically. This is not encompassing of every injury, but it's more common ones that I see in my practice and more common overall. Goals of this talk, we're going to talk about the common injuries, discuss treatment for each injury, and discuss expected recovery and goals to return to sport. The most common by far injury is called lateral epicondylitis or tennis elbow. This is extremely common. It's probably the most common thing I see in my practice. It's caused by injury to the outside of the elbow here, to the tendons, the common extensor origin, and specifically there's one particular tendon called the extensor carpi radialis brevis that's always involved or almost always involved, where over time it degenerates, which is a fancy word of just saying it gets old. And oftentimes there's an injury that predisposes people to this, and it causes a small little tear in it, and it leads to an inflammatory response. This injury, even though it's very common, it does not require an extensive workup, such as an MRI. It's a clinical diagnosis. So if you have pain on the outside of your elbow, pain with gripping objects, picking things up, decreased grip strength, it's almost always tennis elbow. This occurs to almost everybody at some point in their life. Most commonly, it's in age 35 to 50, and adults annually, it affects up to 3%. It's usually in the dominant arm, but not always. And most of my patients actually do not play tennis. It's usually caused by something where they gripped something wrong and picked something up and felt something. To treat this, if you do nothing and just give it time, most of the time you'll get better. It can take a year or more for that to happen. So there are some things that we can do to help speed the process up. Stretching or home exercise program, in addition to some physical therapy, can help significantly. The use of a counterforce brace, which is a brace that goes on the elbow just below where it hurts, it can take the tension off of that area and help it feel better. And then there are injections that we can do in the office, whether it's a steroid or platelet-rich plasma or PRP, that can often accelerate recovery and improve symptoms. I still do surgery sometimes, but it's for patients that just don't get better. And usually it's those that don't get better after a year or more. So a similar problem that's on the inside of the elbow, it's called medial epicondylitis or golfer's elbow. It's basically the same thing to the other side where the flexor tendons on the inside of the elbow get overused, leading to a small micro tear in those. The pain is similar, but it's on the inside of the elbow. It is more common in golfers or people that throw or play racket sports, although you do not have to do those in particular. It can be associated with ulnar nerve symptoms or funny bone nerve symptoms where you can get tingling or pain that shoots down the forearm into the small finger and ring finger. And the treatment is essentially the same as tennis elbow. I really won't go into it much more. Staying on the inside of the elbow, you can get injuries to your ulnar collateral ligament or UCL. So this picture on the left is an MRI image showing the inside of the elbow and this black structure that looks like it's torn off. It's because it is. That's the ulnar collateral ligament. And this diagram on the right shows that it's a complex structure on the inside of the elbow, but most often we really care about this anterior band of it. The UCL is the primary stabilizer to valgus stress or preventing the elbow from bending inward. If people injure this, most often there's different ways you can injure it, but usually you feel a pop on the inside of the elbow and have immediate pain in that area. In throwers, they'll notice pain along with the loss of throwing velocity. And again, with this, you can have symptoms with your ulnar nerve, especially if it's getting stretched out. It can be grouped into two different categories. A traumatic tear is usually in people that are fighting or fall on their elbow where they feel a pop immediately without any preceding elbow pain. It can be associated with an elbow dislocation, or it can be grouped into an overuse injury. And this is typically in throwers where there's repetitive stretching and micro trauma of that ligament. And then all of a sudden, after a while, it can tear off. And usually that's a result of most often poor throwing mechanics. So you can see this diagram down here shows the phases of throwing. And most commonly, it's a problem in the late cocking or the acceleration phase. It's It's due to not enough rest in between throwing sessions, so people that pitch year round are often predisposed to this. Most patients can be treated without surgery for this problem, but that includes rest, and rest means rest. So in throwers, that means 6 weeks of no throwing. After that, you can start some physical therapy because your elbow will get stiff. And after it gets unstiff, you can strengthen it and progress back into a throwing program. And overall, this will take several months to get back to your sport. It is not a quick recovery. In athletes, the treatment's a little bit different, especially in throwers. These used to be career-ending injuries, but our surgical techniques and rehab protocols have gotten much better over time. You can repair the ligament. So you reattach the ligament to where it belongs, and that's usually reserved for younger athletes that have acute tears that are avulsion type, meaning it didn't tear in the middle, it tore off of the bone. It can happen in elbow dislocations, and this is typically not done in throwers. Instead, in throwers, we do a UCL reconstruction, which is a Tommy John surgery, which is some people know about. And to reconstruct it, typically you'll use a tendon either from your own body or from a cadaver. Using it from your own body is more common, and you use that to reconstruct the ligament. Return to sport after any of these surgeries, especially throwing, is not quick. It's at least 1 year, no matter what you do. Moving on, there are tears of the biceps and triceps. So the biceps itself, most people think that it's an elbow flexor, like you flex your arm and your bicep gets really strong. It is, but the major function of it is supinating the forearm or turning a key or a doorknob, that type of motion. The triceps is on the back of the arm, and it's primarily the only elbow extensor. So straightening your elbow out or doing an activity like pushing up out of a chair. You need both of these for most activities of daily living, unless you're elderly and you don't do much. Most commonly, these injuries occur in weightlifting type activities or when you go to pick up something or something happens that you're not expecting. And in general, at least in my practice, surgery is recommended for these problems. These occur primarily in men in their 40s. They're associated with steroid use, other systemic conditions. With distal biceps tears, often or pretty much every time, you'll feel a pop in the front of your elbow. It'll swell. You'll see a deformity there. If you do not treat this with surgery, you'll lose about 50% of supination or that strength to turn a doorknob or a key. And it's important that if this happens to you, you need to go see your physician right away because you have roughly a 4-week window to repair it. After that time, the tendon it's like a rubber band. It'll kind of shoot up your arm and you can't get it back down to where it belongs. For triceps tears, they're a little bit less common. Usually they occur in older people, although they can happen in younger people. And if you treat these without surgery, you will lose almost all the strength with elbow extension or straightening your elbow out. And that's a very important motion and very important strength because as you get older, you need your arms to push up out of a chair. In general, for either repair of both the biceps or a triceps, it's about a 6-month recovery back to normal. At least in my practice for a biceps, I keep you in a sling for 6 weeks. I start you in therapy early on just to get your motion back. Strengthening starts at 3 months, full recovery 6 months. With the triceps is pretty much similar, but I just put you in a different type of brace that controls your elbow motion. I alluded to this previously, but an elbow dislocation is where the joint dislocates. Usually it comes out the back or posteriorly. It's usually due to falling onto an outstretched arm. You'll know it, you'll see it, you'll feel it. It can be grouped into simple or complex, simple being that there's no fracture or break involved, and complex being that there is a fracture involved. And in order for your elbow to dislocate, you have to tear or stretch out some ligaments. So the lateral ulnar collateral ligament, the one that's on the outside of the elbow, always tears. And the ulnar collateral ligament on the inside usually is torn, but not always. So if you have this happen or you know anybody that has this happen, it needs to be reduced or put back in urgently, as quickly as possible. For those that are simple without a fracture, most of these do not need surgery. Typically, I'll splint them for about a week, and then I'll get them out of the splint and start early motion. The elbow will get very stiff, so therapy is very important for this. If you don't do therapy, your elbow will persistently stay stiff. Surgery is only indicated in the patients that even after doing all the therapy, their elbow is still unstable where it wants to dislocate. For those that are complex, that have a fracture, surgery is almost always indicated, and it should be done rather urgently within a couple weeks. To end this, I'm going to talk about some overuse injuries, and these are primarily in throwers. So valgus extension overload. This is a lot of words on this slide, but basically with repeated throwing, the back of your elbow, it's called the olecranon, starts to shear or rub up against the back of your arm or your humerus up here. And when doing that, it creates these bone spurs on the backside of your elbow. In addition, it'll stretch out the inside of the elbow so that ulnar collateral ligament will get stretched. And you'll also get compression on the outside of the elbow so you can develop arthritic changes on the outside. At first, and almost always, the treatment is non-operative. You stop throwing completely, you take time off, do some anti-inflammatories, and then progress in a throwing program. For people that persistently have symptoms despite doing that, there are surgical options, and that's typically going in with a scope and resecting or taking out those bone spurs and potentially doing something on the outside of the elbow. If you're having ulnar nerve symptoms or pain or tingling that shoots into your forearm, that can be addressed as well. Little league elbow is essentially the same thing as valgus extension overload, but it's in children or adolescents. And this particular injury occurs at the inside of the elbow where there's a growth plate that repetitively gets stretched out by the ulnar collateral ligament, and that can lead to a stress reaction and inflammatory response to that growth plate. Risk factors for this are kids that pitch year-round, which is more than 8 months of competitive pitching, if they pitch more than 80 pitches per game, and if they continue pitching despite having pain or loss of their throwing velocity. And again, the treatment for this is always non-operative. They have to stop throwing completely and progress in a throwing program. And this is one of the toughest things to treat, at least in my practice, because it's very hard to get an adolescent or a child to stop doing what they want to do because they want to be better. But the treatment is to stop throwing it's a short period of time. It's not that long in the grand scheme of things. And to end it, this is a relatively rare injury, but I do see it sometimes in throwers. You can get a stress fracture of your olecranon or the back part of your elbow. And again, it's related to continuing to pitch despite having pain, where you get this picture shows this little crack in the bone coming down. And this pain is particularly posterior or the backside of the elbow pain. It's worse with throwing and it improves when you rest. This injury does require either a CT or an MRI to diagnose. And again, this is a common theme, but a lot of these injuries, the treatment is non-operative, and this is complete rest for 6 to 12 weeks until the symptoms go away.